what we've seen in the United Kingdom is a change in their legislation to allow cannabis products to be prescribed for patients with certain conditions. And I just want to make sure that those same abilities apply to patients on the Isle of Man, because we have visiting specialist consultants coming over, particularly neurologists coming over from the UK. And I want to ask the Attorney General whether those changes apply to the Isle of Man. There's a wider viewpoint on the island that we need to look into the use of medicinal cannabis, and the changes made in the UK are really small, but they do have big implications. So I want to make sure that we're still staying ahead of the game and we're having an open policy in terms of looking at what will help patients in the future.
As well as those implications for consultants that come to the island, is it important as well that Manx residents have the same access to treatment as those in the UK?
That's exactly the point I'm trying to make, that if you live in southern England at the moment and you have a child with intractable epilepsy, now you will be able to get medications that will help that child. We should have that same ability on the Isle of Man. I don't see that there should be any difference. And so that's why I'm asking the Attorney General to make sure that our legislation is keeping up to date. But obviously, one of the other questions on the Tynwald agenda is looking at the public consultation about the wider use of medicinal cannabis. I think we need to go far further than the UK have done. They've been very, very limited in their changes. I think we can do a lot better for people on the island who are already using cannabis to help their symptoms, but unfortunately at the moment are using it illegally.
I think we were told that consultation would be due by the end of the year. How far off is that?
Well, the end of the year is fairly close, and that's why I think Daphne Kane has asked the question on the Tynwald paper to get an update on that. I'm seeing patients who are taking cannabis and are at risk of conviction and even being put in prison for that. There is a huge weight of public opinion behind this. There's a huge weight of scientific and medical opinion that these products can help people. And I think we should be moving a bit faster than we have done. We've had commitments from government. We've had commitments from various departments. But I think most people on the islands will actually want to see some movement on this now.
You've already highlighted epilepsy, but what kind of conditions could this help with?
There have been thousands of studies in terms of medicinal cannabis in different forms treating different conditions, but the main ones tend to be neurological conditions. Epilepsy, it's already being used by people on this island with multiple sclerosis to help some of the spasms they have. But we can go further than that. There's some very good evidence for its use in certain psychiatric disorders, particularly Tourette's syndrome and post-traumatic stress disorder, and I've met a number of veterans who are using it for that. Also, it can be very useful for chronic pain and actually reduce people's reliance on drugs that I prescribe, like opiates, which can be incredibly dangerous in overdose and need to be very carefully titrated. So I think medicinal cannabis has got a lot of potential, and we're seeing that in lots of other countries around the world. What we can do on the Isle of Man, because of the structure here, is actually do some really good observational studies to prove the science behind the product.
Cannabis seems to be in the news a lot at the moment. It was discussed at the Biomed conference this week. There's been a cannabis consultant visiting the island. Do you think this is something that there is now a lot of support for?
I certainly think there's a lot of support for looking at our legislation in terms of public opinion. I think a lot of people have actually looked at the science behind cannabis and questioned why it's been made so illegal, why the police, for instance, are spending a huge amount of their time convicting people for possession of very small amounts of cannabis when it is widely used, and when the health benefits within a well-regulated market have been shown in other jurisdictions, particularly Canada and some of the American states. I also think that people are looking for alternatives to more conventional medicines like anti-epileptic drugs, like anti-Parkinson's drugs, like some of the painkillers that we're prescribing, which we know that have side effects, and are looking for an alternative or potentially an adjunct to those treatments, which will help them more in the future and take more control of their health. And I think the government should respond to that need and that inquiry and that demand in a constructive way.